Good morning and welcome. Today is with us Melda Turkoglu, President of Turkish Society of Medical and Surgical Intensive Care Unit. I'm really honored to interview her. She works in the Intensive Care Department in Gazi University of Ankara. Her areas of interest are ICU infection, ventilator-associated pneumonia, acute respiratory distress syndrome, and clinical nutrition. Well, intensive care medicine is a new specialty. Why have you decided to work in the field of critical care? Thank you.
Okay, thank you very much. First of all, I would like to thank you for the organization committee and especially Francesca for this organization and giving the chance to me and my society being a part of this organization. Thank you very much. Critical care and intensive care medicine is really a new specialty in Turkey. I decided to work in this field because I think there are many reasons. First of all, I like teamwork. Critical care unit has a big team. Physicians in university hospitals, residents, nurses, physiotherapists, dietitians, pharmacists. There is a big family, and I like big families. I have a big family, and I like living in a big family. So critical care unit is another big family for me. And sharing the work, sharing the happiness, sadness, all of this, it's very okay for me. So the first thing, I think the teamwork attracts me. The second, I am an impatient person. I mean, I want to see the patient's response immediately. In critical care patients, after giving a therapy, you can see the response immediately. For example, you give fluid and rise the blood pressure if you have any chance. Or you give diuretics to the patients and you see the patient feel better immediately, and there is no possibility for treatment incompatibility. So this also attracts me. And the other thing, I think in my personal or in my private life, I like change something, I like improve something very much. For example, as a hobby, I deal with painting. I like doing painting and convert the old furniture to the new ones. I like this one. Critical care is, I think it is similar. A patient comes to you in a very bad position, near to die, and you do something and you improve and you make her or him turn to life. So it also attracts me.
Thank you. Thank you so much. Would you like to change your job in order to improve the work-life balance?
I think the working hours. I would like to change the working hours. The morning starts early and day finishes late in the ICU. It would be very wonderful if the day started a bit late and finished early, because in the mornings I like doing some sports. I like very much. It is one of my favorites. But at the same time, I must get my little daughter for ready for the kindergarten, and I have another one, another older daughter, and she's preparing for the school, and she wants sometimes being with her. And I also make the breakfast ready, and everything a bit in a hurry in the mornings. And sometimes I couldn't do my sports because I must deal with my daughters. So it is very, uh, how can I say, I always want to make some time to me, but sometimes not have any chance. And in Turkey, the day finishes at 5 p.m., but in critical care, the day finishes at 6 or maybe 7 p.m. Generally. It is too late to deal with your family or spend some time for your hobbies. And at the weekends also, you must go to the hospital and you must do your visit, and this breaks your whole weekend, your holiday time. So I think the working hours must change.
Change. Are there challenges being a woman and a frontline doctor in Turkey?
Okay. Not very much in Turkey. Being a doctor is very respected situation in Turkey. So it is not very hard. But in my family, I sometimes have difficulties because my husband, although he is a doctor and he is a very respectful and polite person, he never changes. He expects something from his wife. And having a doctor wife doesn't change his mind. Although I have a helper for daily work in the house, I'm always responsible from all of them. And sometimes I also feel that my husband is uncomfortable for my frontline situation. Maybe because he's also a doctor and in his work he's also a dominant person and a frontline person, maybe due to this. But I think sometimes I feel that he's uncomfortable from this situation. But other things in Turkey, as I said, being a doctor is a very, very respectful situation. So I don't have any difficulties.
Okay, good.
My work life.
Have you ever experienced discrimination in the workplace or anywhere else?
No, not very much. I thought about very lot about this question, but I don't have any experience. Being a doctor in Turkey is a very, very respected situation. I don't have any
Good,
bad experience. Yes.
good. Well, we have achieved top results in your career. You are international, well known as a successful woman. Would you like to give some advice to other women in order to achieve the same results?
Okay. Thank you very much for your compliments. Thank you. I think three issues are very important. First, you must work hard. You must have good relationships, and you must never, never give up easily. Three important keys, I think. Personal skills are very important. Besides working, you must be social and you must have good relationships, and I think, you must be happy in your life for being successful.
Okay, in your opinion, what opportunity can the iWIN platform offer for young Turkish women who are pursuing career in medicine? What they can do in order to achieve their goals?
Okay. iWIN is a really, really useful platform for women in critical care. Thank you and congratulations for this initiative. And every woman, not only in Turkish women, ones can benefit from this platform. Many successful women from all over the world and with good career in different areas. It's wonderful. It's amazing. And everyone has her own story. and it's inspiring. Every woman can find herself in one of these stories and get some clues being successful and working as a woman. So congratulations, Francesca, and the whole iWIN organization.
Okay, thank you so
Thank
much.
you, Melda.
Thank you.
And that's great. I think you represent a great leader. Your society is 40 years old, older, and you being a president are one of the few in the world. So, I mean, a mother, a wife, president, a doctor, a sports girl, an artist. What else? What else can we ask for? You represent a role model for all of us, really. Thank you
Thank
so
you.
much.
Thank you very much, Francesca.
It's great we can share your story. And so I think this YouTube channel, I hope people will join more and more, because it's refreshing to see the story of women like you, Melda. And I'm so sorry you cannot come here residentially. I wish you to be here, but we still need to stay in a
Yes.
virtual meeting, which is a shame.
Another time, another time.
We wait for you. But we
Thank you.
will
We
be
also wait
discussing on
for
the
you. We also wait for you.
Okay,
Sure.
we'll be discussing virtually on the 25th all day, so that we can share all the topic you mentioned during the interview today.
Okay, thank you. Thank you very much.
thank you very
Thank
much.
you.
Bye bye.
Bye
Thank
bye.
you, Melda. Have a wonderful day. See you on the
Francesca,
25th.
thank you.